And this product has been categorized under food by KKM. We applied through NPRA, and NPRA certified that this product is under food. It is considered very safe, and there is no need to monitor. And with the product category in food, all clinicians can advise the patient to take it without any worries, and you can be free to use it because it's food. It is not a drug. It is not even supplement. Okay, so that is something very good. Okay, so I'm very confident it is safe, and it is also approved by the KKM under food. So this is where we stand now. We hope to see more testimonies from our group, and when people use, I hope you can report to me, or you can just mention in the group what you have observed so that everybody can learn and improve. This is for the patient care, for the benefit of the patient. Okay, because it's very difficult to find anti-inflammatory product without side effect. Very difficult. In fact, there is none. See, and this product, you please try. Please try. Don't just listen to me. You try first. Try on your patient, asthmatic, gout, arthritis, any inflammatory problems, even mild inflammation, it can work. Even for cardiologists, you can also help to remove endocarditis or whatever. Any inflammatory problems that is taking place, if you don't want to use aspirin or any other aspirin related products, you can try and use Nisstex because it can help a lot. And it works synergistically. The most important, right now we are facing pandemic again. There are a lot of issues in the outside there saying that the number of cases are rising, and this needs our attention. And what I can say tonight is that Nisstex can improve the immune system very effectively, especially if we take 1 or 2 tablets a day. The immune system will develop very well. People with rhinitis, I got a response from a mother who treat the son. They give the product 4 o'clock afternoon. The son has got a rhinitis for about 10 years. She gave to the son at 4 o'clock in the afternoon. Tomorrow morning, there's no more rhinitis in that boy. So unbelievable. I cannot believe in the first thing that she told me, oh, no more already. See, the son has to go to the toilet many times a day. And that day, the son did not go to the toilet anymore. So that means the rhinitis is not bothering him anymore. So these are things that we found. So I hope we have good time tonight. Maybe we can open if you want to ask a few any question that if you have time. Those who have things to do is okay. But if you have time, I'm okay. I can be here for a little bit more time. I don't have problem. So maybe can we allow them to unmute if they want to ask question, or you can type. Oh, there. Okay. There is some question here from Dr. Baljit. Is there any ingredient like spermidine in the product? No. We don't put anything extra. We only use the real black seed, which is extracted in UK and brought to Malaysia. We formulate it, and then we add monk fruit here. Okay, the monk fruit comes from China, whereas the black seed comes from Middle East and extracted in UK. So this is what we have done. Okay, so there is not anything. Okay, sorry. I added zinc, okay, and vitamin D. The reason why I added zinc, because thymoquinone needs a little bit of zinc to function. I am worried because some people may be deprived of zinc and vitamin D. So I just put in vitamin D and zinc, very, very small amount. The vitamin D is very, very small. It's about 100 IU only. You need 5,000, 10,000, but I put only 100. This is the quantity that is enough for the thymoquinone to function. So if you take Nisstex, you don't have to worry about the requirement of vitamin D and zinc for the thymoquinone. So that is why I put in. So it's a complete combination of everything that you need in one tablet, plus the sweetener, which is natural. So you don't have to taste all the bitterness and all that. And you can give to kids, because kids will take it very effectively. They don't throw back because it is not bitter. They like it because it's orange colored or orange flavored, and the taste is sweet. So that is the design that we have come out with, and we have used it very effectively on many patients, thousands of patients already, and thousands of testimony. But unfortunately, people do not want to write. This is typical of Malaysian. They do not want to write testimony, or they do not want to make video. They say shy lah, and so many excuses. So I cannot have their testimony. I cannot put testimony without consent. It's not proper. So I don't have much. But slowly we'll be getting. I try to persuade them to give consent. So I will put up slowly. Okay, you have any question? Ui, can you unmute if they want? Can allow them to unmute if they want to ask.
ProfMUS, you can, if you want to ask question, you can just unmute your mic.
Okay. Is it true consuming the product can be quite heaty? If yes, those with recurrent abscess may worsen. Okay. There is no report to say that it is heaty, but it can give you more energy. You are more energetic. I've got some response to say that those who sleep in the day, when they take Nisstex, they don't need to sleep. So this is something positive, and they have more energy. I have a feeling the energy comes from the improvement in the liver. The mitochondria can be more active, can be more functional, because the liver is already corrected. Okay, so the liver is detox in some way. Okay, and for COVID, this compound is very unique. Very few compounds out there can combine with spike protein. So if you have already a lot of spike protein in your body, the thymoquinone, okay, I explain a little bit. The spike protein will need ACE2 receptor to exert its effect. Thymoquinone will block the ACE2 receptor from spike protein. It's similar to ivermectin. Okay, so the effect of thymoquinone in this aspect is very similar to ivermectin. So this is what we have seen, and this is what has been published. A very strong paper to show that the binding of thymoquinone to the ACE2 receptor is as strong as ivermectin and stronger than many other natural products. So this is why it can block the spike protein. So if you have vaccine, excess spike protein or whatever, you can try Nisstex to prevent the side effect and all that. Okay, because it is not detoxing the vaccine. No, it's wrong to say that it detox the vaccine, but it blocks the action of spike protein. Okay, in the right way. Okay, so anybody want to ask anything?
Hi, Prof.
Yeah, hi.
Prof, just like to know, I mean, I hear from you about the posology of this product, I mean, the dosage for the kids and for those who are having disease or for those who have to take as a normal supplement.
Okay, that's very good question. Okay, the dosing. Okay, what we do, the actual tablet has very low concentration. That's why for kids, you can take one tablet, it's safe. Okay, but as you go higher, as the disease becomes complicated, I mentioned to you just now, one of my friends took 16 tablets, and she's doing very well. That means what I'm trying to say is that you can start with 1 or 2 tablets a day for prophylactic. Okay. Oh, now people start talking already. If you unmute, I think, oh yeah, you have to unmute again. Okay. If you have people with disease, they can take a bit more. But as a general rule, there must be a rule for the product. What we advise is for kids, we have 1 tablet for normal kids for prophylactic. If they have problem, they have autism, they have ADHD and the so-called related diseases or Down syndrome, you can take 2 tablets. That's for kids. And for adults, For adults, for prophylactic, 1 or 2 tablets is enough. But if you have chronic diseases, we recommend up to 4. But if you have cancer with doctor supervision, you can go higher. But it has to be some supervision. We don't want to let people simply take on their own. So that is why I was inviting all the doctors to try and come in to help the patient. If you are with them with the Nisstex, you can monitor them because we don't want to allow patient to do on their own. See, that is very, very dangerous for them. See, so you can go to 4, 6, even 8. It's still okay, but with monitoring. This Nisstex will work first on anti-cancer, second on anti-inflammatory. Third, it reduces the effect of the chemotherapy. It reduces a lot of these effects. Okay, so these are a few things that can help. The compound that is acting is alpha-hydrin, which is water soluble, and also thymoquinone. And there are peripheral compounds that is required to act on anti-cancer property, that is nigroglicidine and nigroglicerine. That means they are acting together. One compound is not enough to work. See, so this is where we need the full product, not the oil or the water extract or chewing it, that maybe not good enough. Okay, so this is the real situation of the product and dosing. I hope you can follow the dosing already. Quite simple. Kids 2 maximum, and then adults you can take 2, you can take 4. Serious condition you can go extra. Okay, if you have sore throat for short term, you can take 4 or 6 short term. It's all right. Okay, just like Strepsil. Strepsil you can take quite a lot. Actually 6 is still okay. It's same thing. For cough, if you have allergic, due to viral, due to bacterial, there are a lot of elements that this can help because they are antiviral, antibacterial, and effect on the allergic system or the immune system. So they play their role in small way, but synergistically. So that is how it can work. Okay. Any other question?
Thank you, Prof.
Can I ask,
Okay, you're welcome. Yeah, please.
Prof,
Yeah.
is it helpful for the knee joint arthritis or shoulder joint arthritis?
Okay. For arthritis, we have, I think, more than 1,000 people already who has responded positive. This is mainly, I believe, mainly due to the inflammation because it is anti-inflammatory. Even osteoarthritis, because this also helps in the cytokine system. See, it helps in the immune system. So it works, but for certain people, the time required to eliminate the problem fully is a bit long. In some people, 3-4 days, it works already. But in some people, they take about a few months. The same thing with cholesterol. Some people, the cholesterol reduces quite fast. In 1 month, it also shows some improvement, but some people in 3 months. So the cholesterol will become normalized. So it is not going very low, but it is normalized. It is within safe range. Same thing with blood sugar. This product does not cure diabetes. No way. We cannot do that. But it will stabilize the blood sugar. So that is something that we have observed. People who take this, their blood sugar rarely spike so high. So that is what they, and I also believe that they will be protective for the antioxidant effect of the diabetic problem, nephropathy and all that. It will be very good for the antioxidant part because it prevents all this oxidation or the reactive oxygen species and all that. It will act on the system. So it will be a good antioxidant, prevent all the effect of diabetes. Okay, the adverse effect of diabetes and all that. It prevents deterioration of the disease, but I've not seen anybody cured of diabetes from Nisstex. No way, so far. I don't know, maybe if they take long term, but what we can show or we can prove from the studies is that Even people who are taking metformin and all that, if they take Nisstex, their HbA1c normalized very well. Okay, so that's what has been reported. There was also a study, and also on the prostate. Okay, the prostate is very effective, very effective. Even one paper, I can show you the paper. They compare with furosemide. They say Nisstex is doing the same thing without side effect. Okay, without the side effect. The effect is the same, but this Nisstex has no side effect. Whereas furosemide, you know lah, the effect is quite nasty. So this is what we observe. Okay, any other question?
Prof, hi, may I
Yes.
know if there's any interaction with any other herbal medication or the medication that the patients they are taking? Like, some patients are taking long-term aspirin. Some of them may take some other over-the-counter herbal meds or drug, like maybe fish oil or something. I just want to know whether any interaction.
Okay, herbal medicine, I think we should not mix, because there is a lot of possibility that they will interact, because they are all herbs, and herbal, there are thousands of compounds inside there. We don't know what is what. Okay, so we better do not mix any herbal preparation. But single entity chemical like aspirin or medication, even metformin or statin or whatever, there is no effect, no problem. But herbs, because you see, when we take herbs, we must understand that a lot of these herbs can affect the cytochrome enzyme. Some herb, they induce the cytochrome enzyme. Some herb, they inhibit the cytochrome enzyme. What does this mean? When you do something on the cytochrome enzyme, you can affect any drug. Because if the drug is metabolized by the cytochrome enzyme, if you inhibit it, the drug cannot be metabolized, also dangerous. If you have antihypertensive drug, which cannot be metabolized, the moment you take the third time, you're already hypo. Okay, if you take anti-diabetic drugs, you also get hypo because the drug is not metabolized. It's there in the blood. Increasingly, every time you take the new tablet. Same thing if they are already also inducing. They will break down the drug very fast. So if you are hypotensive, you take the drug, within 2-3 hours, the drug finish already. So you get hypertensive again. So this is what herbs can do to the human body. See, so that's why herbs are very dangerous if you don't do it properly. They are very good medicinal properties there, but do it properly. Not simply take any herbs and combine them here and there because it is good. You can take a lot, you can take every day. No, that is not the concept of herbal medicine. Okay, herbs has to be treated with care. And if you are sick, you take the herb, you get very good effect. Okay, but not taking it excessively, taking it long term and all that. But this is very different from the black seed. I mentioned to you already. We have studied the effect. It has no interaction on the cytochrome, nothing. Okay, it has no interaction to do with induction or inducing of the enzymes. So that is where they are safe. Okay, so I do not advise people to take with other herbs. If you want to concentrate on Nisstex, please concentrate on one, because we don't want to have any interaction. No other supplements that is coming from herb. Okay, but chemicals, drugs are okay. The drugs that we get from the clinics are okay. All of them seems to be okay. No issue. Okay.
Thank you, Prof.
Okay.
Hi,
welcome.
Prof.
Hi. Okay. Yeah.
Hi, Prof.
Hello.
Is it safe for someone to stop taking medication, which currently taking medication, but focus on Nisstex?
Oh, no. You have to get doctor's clearance. You cannot decide on your own and stop the medication because you think Nisstex will help. Because all medication prescribed by doctors, there are some purpose. Okay, only the doctor will know why he prescribed that. A person may have certain thing which is not seen by other people. So you cannot stop any medication by the doctors and replace it with Nisstex. No, cannot be done that way. But you can supplement it. If you take, for example, statin, the doctor prescribe you statin. You can take this Nisstex slowly your cholesterol may be lower and lower, the doctor will definitely stop the statin when he sees that your cholesterol is lower, that's not requiring the statin anymore. So that is the right approach. For example, even if you are diabetic, slowly you take Nisstex, your HbA1c will drop and drop slowly. It's not dropping very fast. So one day your doctor will see, oh, HbA1c already 5. So they will stop. Maybe they want to stop your metformin. It's up to the doctor. We cannot decide. Maybe the drug is given for different purpose. Maybe not for the diabetic, for the kidney. See, so this is different. We cannot stop any other medication given by the doctor. If you want to stop, you can. You talk to the doctor first. Okay, let the doctor examine and let the doctor decide. That is the right approach. Okay.
Thank you, Prof.
Okay, welcome. Any other question?
Hello, Prof.
Hello, yeah.
Okay. For example, stage 1 cancer, lung cancer,
Okay.
without without any chemo or radiotherapy needed,
Okay.
how long the patient take Nisstex?
Okay. As we know right now, from previous experience, people take 6 tablets a day.
All right.
6 tablets a day, 2. Okay.
Mhm.
So that has shown a lot of improvement. But I also have people who took more than that. So they say they feel they don't have any side effect, so they take more. And they say that they feel better. So that is also existing. But if you are under doctor supervision, you can get the doctor's help to monitor your health occasionally. That will be better.
So what are the parameters that we should look into
That
for
is
this
the
type of patients with cancer lung?
There are a few parameters, depend on the stage and depend on the type of cancer. But the best way is to look at the biomarkers. The doctor will definitely look at the biomarkers and they will tell you whether it is going better or getting worse. But some cancer is terminal, you can see there is a problem with the visible. For example, breast cancer, got ulcer, got a problem with the breast itself is stage later stage already where you can see some wound or whatever. That you can see the improvement visually. But I think the best way is to let the doctor assess, because individually we cannot do it on our own. You need a professional assistance. But the healing process, Nisstex can help. Okay, the monitoring and the decision, finally, the doctors should be involved. You cannot just look at the breast and say, oh, dry already, I think I stopped taking the doctor's medicine. No, that is not the right way, because outside may be drying, but inside we don't know. Okay, so I feel that it's better to have it examined by the doctor, and you can take Nisstex continuously because it does not cause any harm or interaction with the drug that the doctor prescribed. Okay, so this is something that I would like to advise. Do not decide on your own when you have such a problem, because you are not the expert to decide. Okay. Okay. Any other question?
Assalamualaikum, Prof. Nida.
Salam. Okay. Oh, Mida.
Yes.
Okay.
Then I want to ask you for those like macam from a patient perspective, right? If let's say we want to approach to the medical team, the doctors in treating especially those like underlying chronic kidney issues with
Okay.
liver cirrhosis and all this. And so how do we approach from a patient's perspective to the medical, introducing Nisstex as a complementary, yeah.
Okay. There are two ways to do that. First, the patient can take, because it is not medication, it is not supplement. So it's just food. Okay. The patient can take in small amount, maybe 4 tablets a day, and that is allowable. And the patient can also inform the doctor and tell the doctor that this is not drug, this is not medication, this is just a food supplement, a food product, not even a supplement, and this is right, okay? And the doctor can have access to the product and see. So that is one way. At least the doctor will know, oh, she's taking this, and if there's anything that is not right going on, maybe it gets worse or whatever, the doctor at least can advise. So these are the two possibilities that the patient can approach the problem. Okay, the best way, because sometimes the doctor also do not have choice. They have limited amount type of drugs to prescribe, and if it doesn't work, what else can he or she do? Nothing much. See, so if something else can help, at least reduce the inflammation is good enough already, because inflammation can cause a lot of problem to the patient. Okay, the suffering and all that. What we want for the cancer patient, at least to the later stage, is quality of life. We want the patient to feel well, at least, even though he got the disease, but he do not suffer. So reducing inflammation is one way to reduce the suffering. I'm sure the doctor will agree with this. And without side effect, there are a lot of other things that you can reduce pain with, but with a lot of side effect, the risk is still there. But this one seems to have no side effect. So why do we have to be so careful about that on these patients? Last time we even give morphine to terminal cases for patients who are very ill and very in pain. And this one is much better than morphine in some way. Okay, not in pain relieving, but in reducing inflammation. It's better than aspirin, much better. You can't keep giving aspirin in such patient as well. So this is what I can say about that. Okay.
Okay, Prof. The next
Yeah.
question, when you mentioned
Okay.
that Nisstex, since it's a complementary, right, and it's a food supplement,
It's a food
so
supplement, yeah.
yeah, so is it safe if let's say we go with spirulina, calcium complex, magnesium, kelp?
I don't know what is the reason. See, sometimes people go overboard. When they are sick, they take everything. But maybe your body do not need everything. See, so we are loading our body most of the time. See, we are loading with so many things, and the body will get worse. See, if you don't need so much of multivitamins, then don't take a lot. It take the good food with the right supplement, with the right product. For example, like Nisstex. If you don't get worse, you don't have to feed so much of things to the patient, because that is overloading the whole body system, especially the liver. This is what most people do when they are sick. They take everything. Anything that people say good, they start taking it. So many herbs, so many products, then you are killing the liver actually. Because all these products, they are xenobiotics. They are foreign compounds. Then they have to go to the liver to get metabolized, to get excreted out. And the liver has limited capacity, especially patients who are suffering already from various diseases. The liver gets worse. So what you are doing is you are putting more things on the liver. And this is something that is quite common, even in the clinics. If you go to the hospital, for example, you go to the specialist center, each specialist will come and prescribe their own medication for their own specialty. When you see the cardiologist, they give anything that has to do with the heart. After next 1 hour comes the gastro people, give another thing. After that comes the lung people, provide another medication. Then comes the ENT people, provide another medication. Comes the endocrine people, another medication. So the patient will be loaded with drugs. See, so this can happen. See, and also, of course, the bill goes up for the patient. But this is something that we want to create awareness. If we can deal with the patient with the minimum amount of interference, and the patient use their own body capacity to regenerate the good health from their own body, that will be the best way, because our body can handle our diseases or our problems on their own. But if we can support whatever we can, but not excessively. Okay, that is what I feel. Okay, that is my opinion. Okay, you may think the other way, but that is what I feel, and I think we can do much better if we understand what the patient load is. See, if the patient has got kidney or liver problem, we do not load them with so much of things. If you load them with vitamins, minerals, that will load the kidney as well automatically. Okay, so this is what I feel. Any question?
Appreciate your valued sharing, Prof. Thank you.
Thank you, thank you. Any other question? Wow, we have gone to 10:30. Right, very good. I don't have problem. I'm very happy if people want to ask question because that will clarify a lot of things. Okay, so we we still have 30 more than 30 people. That's fantastic. I would expect 10 or 15 people only. So good. I will be having more of this type of talk. We can even have it weekly. We will focus on certain topics of general interest, not specific topic of my interest. No, we will look at the general interest, especially inflammatory problem, um, like asthmatic patient. This Nisstex is very good for people with inflammatory problem, proven track record. COVID, asthma, arthritis, gout, autism. This autism is very mild inflammation, but it's very difficult to cure. See, even Parkinson, very difficult to cure. See, ADHD, very difficult. ADHD and Parkinson and autism, the drugs themselves are very nasty. You can ask the psychiatric people, the psychomedicine people, all the drugs are not friendly enough to the patient. They are very toxic. When I give lectures on antipsychotics, the first thing that I would like to stress are the side effects. The side effects are very nasty, and the patient, the doctors have to know. A lot of side effects that are not desired by the patient, and sometimes it can get worse. So this is the problem with this area of treatment. Okay, so Nisstex does it in a very subtle way. Okay, so we try to take advantage of this situation. At least start with all this to help the patient. What we must remember is that the safety of the patient is ensured. It's very important. You can try any drug, but you must make sure that the drug is safe. If it makes it worse on the patient, that is not a good try. That is not the good risk to take. Okay, what is important? The patient must be happy. They must be safe on the patient. If it doesn't work, it's fine. Not all drugs work. See, but it is safe. That is the concept, the philosophy of it. Do not make the situation worse. Okay, and I have seen many GPs who treat the patient. The patient are very happy because they don't have to come back every month for pain. They come back to just have medical checkup. No more complaining to the doctor. What you give me last time, the pain come back. No. See, so this is what I've seen. I used to visit many GP clinics and discuss with them, talk to them. So they are very happy that they say the patient come back, but they don't complain. Last time they complained, doctor, I have this problem again. Like scolding the doctor lah, things you are not good lah, all that. But what is happening now is that they come back to do a checkup. They don't have the complaint like some who took nebulizer. Most of the nebulizer are expired without being used. They don't use that anymore. They don't need. So this is what I've seen. Okay? You can try on your own patient and tell me. Okay? This is reality. So I'm very happy with that. But of course, there are individual differences among patients. There are also inter-individual differences. So all this we have to acknowledge. That means not all patients work the same. Even Panadol, so there are some inter-individual differences. So when you give this to the patient, you don't expect 100% of the patient respond the same way. there are differences. So we have to understand this as well. Okay. Okay, any other thing? Wow, we're going marathon more than 1 hour already. And I still see a lot of people. So thank you for being with us still. Any other question? Anybody want to ask anything? Okay, if no question, then maybe we have to come to an end. So maybe people shy to leave when we didn't close it. Okay, so okay, what I would like to say is a big thank you to all the group members, and I think maybe some non-group members, doesn't matter. But we thank all of you for being with me tonight for more than 1 hour, and I hope you will benefit in some way. If you have any other question, you can either put in the group or you can message to me directly. If you feel shy, you can message to me directly. I will try my best to answer. That is my work. Okay. Not many people who formulate drugs, they have to sit and answer to all the users. You go and buy Panadol, nobody will answer to you if you ask question. You don't want, you don't take. But for me, whoever consume my product, I will try to support, because I feel that this is interesting. I'm not a businessman. Okay, I am an academic. My job is to support, to tell people the right thing, and to help people as far as I can. So thank you very much, and I hope you have a nice evening and good night, and Assalamualaikum warahmatullahi wabarakatuh. Thank you very much. Okay, we shall end here.
Okay, thank you.
Thank you.
Thank you, Prof.